Nearly 1 in 4 Americans reported that their medical condition got worse after they delayed visiting an emergency department because they feared their health insurance companies would not cover the costs.
Patients should be seeking care, and yet they're not. And it's leading to harm, which can in some cases be permanent. I saw a 52-year-old woman who was almost on her deathbed because she delayed seeking care because of the concern for the cost.
The poll by Morning Consult also found that 1 in 4 Americans said they've lost access to their doctors in the past year because those doctors were no longer in their insurance company's networks. More than half of Americans said they were paying more for their insurance coverage. Many people don't realize how little coverage they have until they need medical care, and they are shocked at how little their insurance pays.
Patients have insurance if the insurance is there when they need it. And the problem is that while people may pay their premiums and think they have insurance, if they have a $1,500 to $6,000 deductible, in fact, they have coverage past $6,000, but many of them don't have that $6,000, which means effectively they have no insurance.
Patients can't choose where and when they will need emergency care and should not be punished financially for having emergencies. This problem is also forcing many people with emergencies to try and diagnose their own medical conditions or to seek alternatives to emergency care.
1 out of 5 Americans said that they went to their doctor's office or they went to an urgent care center and then were referred directly to the emergency department because their medical condition required more than the resources that the doctor's office or urgent care center had. We think that that's sort of a needless step.
If you think you have the symptoms of a medical emergency, seek emergency care immediately. Dr. Kaplan says everyone needs to find out what their health insurance policy covers and demand fair and reasonable coverage for emergency care.
Insurance companies need to be mandated to cover emergency care for patients. I don't want patients delaying care because they're afraid of the cost. I don't want somebody saying, oh, this is just a little bit of indigestion and suffering a massive heart attack because they're afraid to go to the emergency department because they're afraid of how much it'll cost them.
For more information on this, please go to www.faircoverage.org.